Hi, everyone. Thank you so much for joining us for this panel discussion about the coronavirus and where it stands right now in Illinois. My name is Lauren Petty. I'm a reporter for NBC5, and I'd like to introduce everyone who is taking part today. We have some great experts in their field who are joining us. So first and foremost, joining us is Dr. Derek Robinson. He's the Vice President and the Chief Medical Officer at Blue Cross and Blue Shield of Illinois. Thank you for joining us, Dr. Robinson. We also have Dr. Allison Foster. Dr. Foster is a Lurie Children's pediatrician who is in private practice at Child and Adolescent Health Associates. Thank you as well. And we also have Dr. Emily Landon. Dr. Landon is the Executive Medical Director of Infection Prevention and Control at University of Chicago. Thank you so much for taking the time. There's so many questions out there, so let's dive in. Dr. Landon, I'd like to start with you because I know you participated in Governor J.B. Pritzker's briefings and news conferences for several of them. And I want to start with a tweet that he had over the weekend. He said, quote, "We remain concerned that cases are rising and positivity rates are inching up." He went on to say that face coverings are an effective tool in this fight. So can you give us sort of an update on where we stand right now in Illinois with case numbers and the positivity rate?
Yeah, unfortunately, the cases are ticking upwards. I think there are some outbreaks south of Chicago in some other parts of the state that are probably driving a lot of that. But we are seeing a slow but steady small increase in the city of Chicago as well. This is important because we've just done this phase 4 reopening. And so far, Chicago's been doing, and Illinois has been doing really well with our reopening plan because we've been taking it slow and steady, and we were very early to require face coverings. That seems to be a crucial turning point for every state that does it. And so all I can say is we really need to push that facial covering issue. And if we want to keep ourselves as open as we are, we need to be very judicious and very careful about how we proceed now. Wear your mask whenever possible. Choose outdoor activities over indoor activities. Choose activities that let you wear your mask, and always clean your hands.
Okay, so some good advice there. And Dr. Robinson, I know we've talked offline about the disparities that we're seeing, about the communities that are being impacted the hardest. Right now, we're talking about minority communities, Latinx, African American. What are you seeing right now that concerns you about this pandemic?
Sure. Well, as was noted, we've made a lot of progress, but we do see disparities playing out in the pandemic. We've seen it with death rates in individuals over the age of 80. We also have seen it with individuals that live in institutions, so whether that's a nursing home, a homeless shelter, individuals that are incarcerated. So we see disparities in infection rates there. But yes, in terms of racial and ethnic disparities in infection rate and death, we've definitely seen that really in the spotlight of this epidemic in Chicago and across the state of Illinois. We know that African Americans and the Latinx community are more likely to be hospitalized and more likely to die, especially in the African American community. That has been the case. And when we go back and look at kind of the peak of the pandemic, late March, early April, we saw a positivity rate very, very high in the African American community. And to put it in context, like 4 in every 10 individuals being tested were testing positive. And just within a week or two after that, mid-April, we saw almost 5 in 10 in the Latinx community testing positive as well. So a lot of effort's been put in by everyone that's watching this video today. And we've seen a decline in that positivity rate over weeks, but we have continued to see that rate remain higher in the Latinx community relative to others. So like the last 7-day rolling average for the state is around 3%, also in the African American community as well, but in the Latinx community, it's 9%. So that's 3 times what we're seeing in the African American and in the white communities. And when we look at all the different age bands, African American and Latinx representation is much higher than it should be. And really interesting when you look at the 20 and under age band, about 45% of those 20 and under are in the Latinx community. So we need to understand what's happening in that age demographic. And in terms of the disparities that we've seen in infection and death rates, I think there are 5 kind of major drivers of that. So one is going to be occupational exposure, income and wealth gap, housing, chronic medical conditions, and a quality of care that individuals experience. And I can just briefly dive into those real quickly. So when we look at occupational exposure, our Black and brown communities are more likely to be essential workers. So they're amongst the last people to come off the front lines, and and the first to come back to work when the economy reopens. So when you think about your mail letter carriers, your postal sorters, your servers in restaurants, your bus drivers, even if you look at the epidemics of outbreaks and meatpacking factories across the country, 82% of those occurred with ethnic minorities. When we look at the income and wealth gap, very significant. Chicago Community Trust has a lot of good data out there regarding this issue in Chicago. In Cook County, for every $1 of income that a white individual makes, Latinx brings in about 67%. In the African American community, about 47 cents on the dollar. And when you look at before the pandemic, Black and brown communities only had about 65%. 65% of them didn't have enough savings to last them for 3 months above the poverty level. So now we're in the pandemic. So there's a lot of pressure for people to return to work because they don't have the cushion from an economic perspective. A lot of folks don't have credit cards, so you're not going to order groceries to be delivered to your house. Extra masks. There's a risk for additional exposure occurs as a result of that. And then when we look at housing, so we know that there are a lot of multi-generational families in the Black and brown community. So that means if you have a younger person that's of a lower risk, they're infected, they have a higher risk of transmitting it to their grandparent or someone in the house that may have a chronic medical condition. And when they look at cities across America, those cities that have hyper-racial segregation tend to have a larger disparity between races in terms of infection. And that's part of the fabric of Chicago. And so we see that play out. We know that we have a 30-year life expectancy gap between Streeterville and Inglewood. And a lot of that plays out not just among geography, but also across racial and ethnic lines. And then finally, when we look at chronic medical conditions, significant disparities in obesity, cardiovascular disease, diabetes, these are pervasive across our minority communities in the city. And then when we look at how folks experience healthcare, we know that these communities bring a significant level of mistrust to the healthcare system based on their lived experiences. And even if you look at the representation of our healthcare workforce, African Americans, for example, make up 14% of the Illinois population, but only 7% of the physician workforce. Look at Latinx individuals of Mexican descent, 13% of the Illinois population, but 1% of the physician workforce. So there are a lot of underlying social determinants of health that impact what we're seeing in the pandemic. But we all on this call recognize that before the pandemic, we have huge disparities in life expectancy, infant mortality, and the like. So we've got a lot of work to do to mitigate transmission during the pandemic, improve survival, but there are a lot of underlying social determinants that we've got to address for the long term coming out of the pandemic.
Yeah, it's shining a spotlight on areas that probably should have seen the light before, and some did see. And now I think that hopefully, if anything good comes out of this, there will be some changes made there. Dr. Foster, I want to bring you in here because you have an interesting perspective with this pandemic, because obviously you treat children. And in the beginning, it seemed like children weren't getting the coronavirus. There have been so many different, over the weeks and months, we've seen different, variations of how children are being impacted. What are you seeing now, and what are your concerns for children with the coronavirus?
Yeah, great question. And first of all, thanks for having me to be a part of this, Lauren. These are really great issues. And I just want to start by saying my heart certainly goes out to any family that's been affected by coronavirus, whether it's through, illness of a family member or loss of a loved one, and especially for the parents who've been, the parents out there who've been in unique situations of perhaps having actually a child who's had a COVID-19 related illness or complication. I will say that while some kids have been affected by coronavirus, this is largely an adult illness and issue. And that's really remained the same from the beginning of this pandemic, from the beginning of knowing of this virus. If we look back, overseas in Asia, in Europe, when it first entered the United States, and where we see it now in this country, the numbers have remained the same. If we look at the number of cases of COVID-19 infection that we've had in the United States at this point, upwards of 3 million, about 96 to 98% of those cases were in adults. And that leaves about 2 to 4% of cases of COVID-19 affecting kids. And with more of those cases in the older age range of the kids, middle schoolers, high schoolers. So, while, if it's your child who's in that small percentage is definitely significant. And as a pediatrician, it's all significant to me. But I think that we can have a little bit of comfort in knowing that this virus, from what we know now and at this point, behaves very differently in terms of its impact on children compared to many other viruses that we know very well. Many cold viruses, many other respiratory infections caused by viruses such as influenza. And the unique thing with those viruses compared to COVID-19 is that children are oftentimes the drivers of community spread with those illnesses and viruses. That's not the case with COVID-19, and we know that pretty well, that kids are not the shedders and spreaders that they typically are with viruses with COVID-19. You will be hard pressed to find a child at the center of an outbreak in terms of being an index case causing a vast amount of spread. And we've got some really good scientific papers coming out that have shown that to be true through, the information we've gathered from contact tracing. So, I say that because I'm hopeful that we can provide a little bit of clarity and clear up some misconceptions out there that may fuel a little bit of anxiety and fear in parents, especially at this time as they're making some really critical and crucial decisions for their family in terms of what to do as we decide on kids re-entering schools and which option families should choose that suits them best. But
so that was actually going to be my question next.
Yeah.
If we're talking about these reopening plans, I know some various districts have already weighed in, some are still waiting. Do you have any advice, I guess, for parents about if they have to choose? I think one of the school districts just gave parents the choice. They can continue remote learning or they can send their kids back. How would you advise parents at this point?
Well, I think everyone at this point knows very well that the American Academy of Pediatrics has come out very strongly in support of when it makes sense, meaning when we're, if you're living in a region, an area, a community where you're not having widespread surges of higher rates of infection, where you have local control, that it makes sense for kids to be back in schools for in-person learning. Now, it's nuanced. So, what that means will vary depending on where you are. For a lot of school districts and schools, what it seems to be is that parents will have a choice of either a hybrid learning model where kids will be in school maybe 2 or 3 days a week for in-person instruction, following very strict guidelines of masking, temperature checks, symptom reporting, physical distancing by spacing the children apart in the classroom, limiting the ability for parents and other adult outsiders to come into the building, since we know that those are the individuals that are more likely to be infected with coronavirus, be asymptomatic with coronavirus, and spread coronavirus, again, not the children. So, with that model in place, I think that's certainly a very reasonable option for parents. I myself am a parent, and I am confronted with this issue now, and I will be sending my children to school in the classroom for the hybrid model. For parents who aren't quite as comfortable with that option, there seems to be options available for many families to choose a virtual learning environment and to continue on with that. And I don't think that you're wrong for choosing either one. We each have our own sort of level of risk tolerance, risk appetite that we are comfortable with. And, even in the face of knowing the facts, knowing that kids are less likely to be ill, less likely to have severe complications from coronavirus, certainly less likely to have a terrible outcome from it, less likely to spread it to others, that you still may not feel comfortable at this time, and it may not be the right fit to send your child into the school, and that's okay. So having a variety of options for families, providing reassurance to families, and trying to educate as physicians our families is going to be key as we navigate through this.
And Dr. Landon, I know we had talked earlier about you really, as hard as it is, uncertainty is so difficult, especially for working parents, whether, uncertainty is just frustrating right now, but we have to be prepared that whatever plan we do put in place could change depending on what we see as far as what happens with the cases. Is that right?
Yeah, flexibility is the answer to that horrible feeling in the pit of your stomach about the uncertainty that surrounds everything with this pandemic. It would be great if we could say that we are done with this and just move on, but we can't. And we're not going to be done with it for a while, and things are going to change. They're going to be influenced by factors that we can't control as a human being, as a family, as a state, as a city, as a country. And we need to just find a way to acknowledge that uncertainty and make a plan A, a plan B, and a plan C. And maybe that means that you say, well, if things are, good and like sort of like how they are now, then I'm going to send my kids to school. But if they reach this sort of situation, whatever you decide is your risk tolerance, then we're not going to send them to school. We make these decisions about our risk tolerance every day when we decide what activities we're going to do, what foods we're going to eat, how we're going to live our lives. We're just not very familiar with making those risk assessments with this coronavirus pandemic, but we're all getting experience under our belts, and everyone should feel confident in their experience under their belts. And I think it's really important to get your inputs for what you use to make your assessment from reliable sources. Please look at science. Media, especially things like this, are doing a good job of increasing awareness, but it's important to take everything with a grain of salt a little bit and to make good decisions based on your risk tolerance. But please follow the science. This is a very real illness that causes very real problems.
So speaking
Lauren,
of risk tolerance, go ahead.
Yeah, I was just going to add that, Dr. Foster and Dr. Landon have underscored the fact that we have to really stay humble, and we all appreciate that information is continuing to evolve over time. And so I think as healthcare professionals, we're trying to give, and public health professionals, trying to give the best information that we have available now, with the caveat that may change and evolve over time. And so we do need folks to remain flexible, and we need people to be patient as well, because again, we only have about 8 months of global experience with this infection. And I was joking earlier that, we live in this environment where we're accustomed to, the internet and microwaves, but what about when there weren't microwaves and you have to wait on your food to get warmed up, right? That's a light year, seems light years away from where we are right now. And so people want answers, they want certainty. And we're in a situation right now where we don't have that absolute certainty, and the information will continue to evolve. And so we do have to remain patient and remain flexible.
I think people are looking for guidance. So one thing that people I know have been asking about is summer travel. Before we get to the reopening of school, a lot of families plan that trip. They go to the beach, they go on vacation. I guess if I can just kind of go around and ask each of you, would you travel? I know we have in Chicago, we have this, advisory that if you go to certain states, you're going to have to come back and quarantine. Again, it's assessing your risk, but can we talk about getting on an airplane, or any advice you would have if someone does have a trip planned to one of these states, or even just to a neighboring state like Michigan or Indiana, which are not on that list in Chicago? But I guess, Dr. Robinson, can you take that first?
Sure. Well, I want to say just because you can do it doesn't mean that you should do it. That's the thing that we have to think about. We have to be responsible and be mature as we think through the risk that we're trying to mitigate. Certainly, there are going to be instances that pop up. You have a ailing family member that you need to go and check on. So be responsible, mitigate your exposure risk, get tested before you travel, have the family member on the other end get tested as well, and try to mitigate their risk. And then when you get there, wear a mask. The mode of getting there, I would personally recommend, a ground transportation, taking a car, if at all possible. Air travel introduces a lot of different factors that you have less control over. If you have to do that, you want to maximize your protection. From my perspective, that means you've got a mask on, you've got goggles on, and you've got a face shield on as well, because you can't control who's next to you, who's in front of you, who's behind you, and very strong hand hygiene as you're moving through that travel process. But again, I don't know that this is really the time for leisure travel, just given all of what we've invested to get where we are today. And as Dr. Landon noted, when you look at all the rates that are jumping in different states across the country, we want to be responsible and ensure that we're doing our part to keep our community safe.
Okay, and I see you both Dr. Landon and Dr. Foster nodding your heads. Do you agree with what Dr. Robinson just said?
Yes.
Go ahead, Dr. Foster.
Yeah, I mean, I certainly do. And I think that he makes a really good point that, as time goes on and we really get fully seated with this virus and our new normal, we can potentially become a bit complacent and a bit lax in terms of our personal responsibility from a public health standpoint and protecting our neighbors, protecting our more vulnerable in the population, and really doing what's necessary to mitigate the risk for everyone. So, yeah, just because you can travel now or go out and do more things doesn't mean that's always the right decision to do. I do think it's very important for families to still have time together, that, look forward to summer vacation, summer trip before the kids go back to school, having this time together to really, re-energize and connect. And I think there's ways we can still do that for families and make it happen. We're almost in a point where we're going back to decades past of what summer vacation may have looked like. And that might be a camping trip with the family, by yourselves, the family you've been living in the household with. You get in your car and you drive to a campsite, and you guys bring your own food to cook. You bring your portable toilet. You sleep in your tent or your RV, whatever you have, and you have a good time together making memories. And I think that certainly that sort of vacation is maybe more what we need to look to, as opposed to what we've been accustomed to in the recent past.
Okay. And Dr. Landon, anything to weigh in?
I think I was going to say, just because leisure travel isn't a great idea right now doesn't mean that leisure is out of the picture. Just like Dr. Foster said, there's so many options for what you can do. It's time to rediscover the great outdoors and look at some of the great sites that there are in parks. And I don't know, I have it in my head that I want to visit Starved Rock. I went there as a child. It's all within driving distance, and I kind of think I want to go back. Next week, I'm actually taking a vacation for the first time, my first hours off in many months. I hope it works out. We're going to go visit my mom in the suburbs. And so, but in order to be able to do that, to visit other family members, I've been really careful in the last couple of weeks to make sure that I don't have any excess risks. She had to take a flight home from Florida. She'd been stuck there and safely did so, following guidance. So it is possible to travel safely, but you really do have to take a lot of mitigating effects. There's a lot of good information out there. There's guidelines on camping that the Illinois Department of Public Health put out, in the Illinois Recreation, I forgot what agency it came from, but there's guidelines on camping during the COVID outbreak. And there's all sorts of good information about how you can have leisure time with your family, or even expanding that a little bit. We went to visit a couple of close friends. Again, we're not eating out in restaurants. We're not going to gyms, so that we can save up our time and our risk in order to spend it on spending time with people that really matter to us.
Okay.
We went to Michigan for that, but that's a driving, just a weekend, so there's ways
I think it's good to hear from you guys how you plan on spending your vacation and your leisure time. So I think that's important. I wanted to ask, Judy had messaged me. I've been taking questions from our viewers, so I want to get to some of those. Judy had messaged me about seniors. They had been encouraged in the very beginning, because they're high risk, to stay inside. Is this still so? Are they still isolated, or can they venture out taking the proper precautions, hand sanitizer, social distancing, and wearing a mask?
I'll answer first and say that it's really important that we have sort of risk levels for each of us. My mom is older and in that population. And so, like I said, we're very careful before we have time with her to make sure we're not bringing in something that we picked up in a restaurant or a bar. I'm not going to any bars. And so, and I wouldn't recommend any seniors or high-risk individuals do so either. So there certainly are, like we said, just because you can do things doesn't mean you should. And certainly I think that seniors, while they don't need to stay home, they certainly do need to take extra precautions. Don't skimp on the mask, and honestly, they need to be really careful about spending time around people who aren't wearing masks, because that really puts you at greater risk. Masks aren't perfect at protecting you, but they're really great at helping protect others, because they hold in your respiratory secretions. So don't think that your mask is going to protect you from a bunch of other people that aren't wearing one. You want everybody to be wearing a mask. And so that's the sort of thing that you want to have that heightened awareness if you're a senior or if you're in a high risk category.
Okay. I was going to ask about testing next, if that's okay. I had a lot of questions about testing One includes when to get tested, which actually has come up repeatedly as far as it's unclear, because we've been hearing that there could be days before people even show symptoms, that they actually are either asymptomatic or pre-symptomatic, which I think is its own, debate as far as what it is. But when do you recommend, if, let's say, for example, I was at a barbecue and I find out I was, social distancing, but I found out someone at the barbecue that was on a Saturday ends up testing positive for coronavirus. When should you get tested, and could you need to get repeat testing? I don't know if there's anyone specifically. Dr. Robinson, do you want to start with that?
Yeah, so I'm going to admit that I'm not sure on the exact window between the time you're exposed and the time that your test will come positive. What I will say is, if you're exposed yesterday and you decide to get tested today, I'm not sure that your test is going to come back positive. Okay. I don't think there's an urgency to get tested immediately, as long as you're not having symptoms and you're feeling well. But knowing that you were exposed, you should be self-quarantining and ensuring that you're not exposing others. And certainly, I think by the end of that following week, I would go and get tested. Okay. And keep in mind that the testing that you get, you're going to need the PCR testing versus the antibody testing, because that tells you what the PCR testing, the nasal swab, is whether you're positive or not. The antibody testing really looks at, could you have been exposed to the virus in the past? And so certainly that would be the test that would be recommended.
Okay. And Dr. Landon, I know you were nodding your head. So so as soon as you hear you've had exposure, the advice is to quarantine, but maybe wait a little bit until you get your test?
Yeah, I'm going to go through, I think this is really important. It's critical. And so I want to sort of lay out when testing is needed. Everybody should be tested if they have symptoms. Any symptoms at all. If you're not feeling yourself, you're getting more headaches, you're feeling fatigued, you can't smell very well, you can't taste your coffee in the morning, not just fever, cough, and shortness of breath, but any of those things should make you stay away from other people and get tested. Now, that's number one. Number two is this exposure testing, and there's really two minds about this. There's testing after an exposure to know whether or not you have the coronavirus. And then there's testing for contact tracing purposes. And I think there's a little confusion. So contact tracing, and the CDC is recommending testing is for everybody who gets contacted by a contact tracer, because if they are already positive by the time they're being asked to stay home and quarantine and contacted and let know that they've had an exposure, then those contact tracers need to trace them as well. And so there's a recommendation to get tested right away upon notification at the time you're going into quarantine, so that you can protect any potential contacts. But like you all have mentioned, that doesn't help you know whether or not you're going to get sick in the future. And so especially if you get notified early on, that may not be the right time. If you're not being contacted, or if you don't feel like you've had other contacts that need to be notified in the short time since you were at that barbecue or whatever you did that resulted in exposure, then 5 to 8 days afterwards is the window in which you want to get tested. We can't narrow it down much more than that right now. And so I would probably err toward the middle of it. Days 6 and 7 is probably where you want to go. But of course, some testing centers aren't open on weekends or whatnot. So plan on that 5 to 8 days. Quarantine immediately upon learning that you've been exposed, and then plan on getting a test, symptoms or not, around 5 to 8 days. And then no matter what, if you develop, you have to stay in that quarantine for 14 days, because some people do get sick later. And if you develop symptoms later, even if that first test 5 to 8 days was negative, you should get tested again. Being negative once in that 5 to 8 day window does not mean that you're going to be home free.
Okay. That's really important, because I think a lot of people hear that they possibly have exposure and they run out and get tested and think, oh, I was negative, I'm in the clear. But that's not the case.
No, you are not in the clear until 14 days have passed and you are negative at that point. In fact, you could get asymptomatic infection later on. And to be honest with you, the test that we use, even the PCR test that we were talking about with the nasal swab and nasopharyngeal swab, even those are not as sensitive, not as good at picking up asymptomatic disease as they are symptomatic disease. So if you have no symptoms and you get tested in that 5 to 8 day window that I recommended, it could still be falsely negative. So you've got to stay home.
Now, I did get a message from someone who said, oh, I'm sorry, really quickly, I have a lingering cough for months, but no fever or other pain. What about something like that, where because cough is one of the symptoms, would you recommend they just go get tested for peace of mind? Or at this point, yes, okay. So go get tested.
I think for people who have had a lingering cough that aren't really sure what's going on, there could be something underlying it that isn't COVID. You should see your doctor. They're probably going to do a COVID test. They may look for COVID antibodies to see if you might have had the pneumonia earlier on, and now you just have you're sort of having a slow recovery. And so there's a lot of things to consider. You could also just have allergies, postnasal drip, something like that. Those are the common causes of chronic cough. So, but those can be fixed as well. So definitely go and see someone if you're having a lingering cough.
Just go see your doctor. Okay. I'm just making sure that I'm not missing any of the questions. I think that timeline was really key for the testing. We want to talk about delayed immunizations and screenings as well, which I know, especially Dr. Foster, for children, as a pediatrician, there was this concern in the beginning of the pandemic. I'm not taking my child to the doctor. Sure. I don't want them to get coronavirus. But there is concern. I know Dr. Robinson, I'll address you in a second, but I know there is concern that if you don't do these other illnesses, these immunizations for other illnesses, those are even more serious than coronavirus. Is that right?
Oh, absolutely. That's been a big concern of pediatricians during this entire time. I feel as though now, as we're doing more education and really trying to put forth the effort, especially the individual pediatrician practices of letting their patients know, hey, it's safe to come in here. These are the measures that we're doing to keep you and your family and your child safe if you come in. This is really the true risk to your child in general with COVID-19, and really trying to drive that message home. Families have felt a lot more comfortable coming in. We've certainly seen that in our practice, where we had a dip in numbers initially with our just routine checkups for healthy kids, and now we're pretty much back to full, which is great, because it's very important for kids to not only stay up to date with their immunizations so that we don't see a reappearance of diseases of past that we may take for granted a bit now, because we have done such a good job through the immunization program of keeping them at bay. But we also need that time for our yearly checkups and check-ins with our families and our children to ensure that their social, emotional, developmental, mental health is doing well. And, there's no time like a time in a pandemic where we can see other issues come up for kids that they're struggling with, that sometimes are even sort of missed by parents because they don't realize that the manifestation of this symptom is from the pandemic. Perhaps they're having trouble, the child's having trouble sleeping at night, or is having new behavioral issues that seem odd or unusual, or seem a bit withdrawn or acting out. And this is a great time for our regular check-ins and check-ups to be able to address those issues and help the children, help the families as much as we can.
And Dr. Robinson, I know I talked to you about Blue Cross and Blue Shield of Illinois had some really, I think, eye-opening numbers as far as how down some of the cancer screenings, mammograms, I think it was colonoscopies were down 71%, mammograms were down. These are things where early detection is key. So would your advice be, you cannot put these things off? If you were supposed to get screened, you have to, go in and make that happen.
Absolutely. We want people to return to care and get their preventive screenings and immunizations done. We certainly know that when we compared our data from March of this year through the end of June, we saw colonoscopies down 57%, mammograms down 48%, pap smears down 46%. Folks should not have to choose between early detection and treatment of cancer and remaining well from COVID-19. You can get both your screenings and get them safely in today's healthcare system. As Dr. Foster has shared, practices are going the extra mile to ensure that they're able not only to ensure that care is provided safely, but that also the individuals healthcare workers can be protected as they're providing care. As an emergency medicine physician, I also know that we've seen CDC reports reflecting that emergency department visits were down 42% during the course of the pandemic, and specifically heart attack visits down 23%, stroke visits down 20%. I know, and everyone on this panel knows, that heart attacks haven't gone away, strokes haven't gone away. In fact, we're probably having more of those, but people aren't seeking care because they're afraid. And so we want people to know that you don't have to choose between a heart attack and staying free of COVID-19, or a stroke and COVID-19. In fact, heart attack and stroke will kill you much faster than COVID-19 will. So if you're having those symptoms, call 911, seek care. Our healthcare facilities are here and available and ready to take care of patients and do so safely. But we're able to do that as long as we're all doing our part, we're wearing our mask, and we're keeping the curve flat. If we let our guards down, and then we have these huge spikes and a lot of sick people in the hospital, we begin to consume a lot of PPE, then it becomes much harder for folks to get in and get their regular routine checkups and visits and screenings in, because we're having to shift staff to care for folks that are critically ill and preserve more PPE. So we've got to all do our part. Don't let the preventative screening slip, but also ensure that we are being responsible.
And speaking of the heart, I know that we're learning actually just recently the impact of the coronavirus on the vascular system has been in the news. Dr. Landon, can you talk a little bit about that? One person had a question. Is there any evidence that blood thinners or aspirin could help if you are concerned, if you have a vascular issue and you're concerned that that could be a long-term impact of coronavirus?
There is an important issue when people are very sick with coronavirus. They're more likely to have blood clots than other times. And blood clots are what cause heart attacks and strokes, and then, of course, other blood clots in peripheral limbs, that sort of thing. If you have a higher risk of having blood clots for whatever reason, you should definitely talk to your doctor, especially if you develop COVID or symptoms of COVID. When we admit patients to the hospital with COVID, we often will give them things like aspirin. But it is not wise for people to just start taking aspirin without having a recommendation from their doctor, just in case they get COVID. There are other things. The aspirin can cause overly thin blood, can result in too much bleeding if you were to have an unexpected injury or a fall or something like that. This is a very delicate balance. And it's important that you talk to your doctor. You need an individual plan for this. There is no way to just give everybody blanket advice. Wearing masks, great blanket advice. Aspirin, individualized.
Okay, that is important.
I think,
go ahead, Dr.
I think it's worth saying twice. So the doctors we're not taking aspirin on our own.
No.
We're not recommending our family members and our patients start, taking aspirin and other antiplatelet, anticoagulant medications as a prophylaxis to COVID-19. That is not the clinical recommendation. But certainly patients that are in the hospital are being treated prophylactically for blood clots and may be on antiplatelet meds. What we're recommending is masking. We're recommending our family members go and get their colonoscopies. My mother had hers done this week. That they get their mammograms and all those things done. But don't go out and start clearing the shelves.
Absolutely. One question with masking, actually, one person Rob had written in, why is there so much conflicting information? When you buy a mask, it says right on the box, it won't protect me from coronavirus. I don't know is that just a disclaimer that the company has to put on there? I mean, because that is a little conflicting, I would think, if you're in a store going to pick one up.
I want to address this because this is a really important topic to me. So no company wants to be sued because you got coronavirus because you didn't wear the mask right, or because you weren't following directions, or you didn't wear it all the time, or you just got coronavirus anyway. And so they have to put that on their label. Now, masks themselves, we really need to be all in order for them to work. Medical masks that we use in the hospital when we take care of patients with COVID-19 that are having these procedures that fill the room with COVID droplets, we wear a lot more protective equipment. You shouldn't use that equipment outside of a medical setting. It is not necessary. Instead, you need to be careful about the situations you put yourself in, and we need to have everybody wear a mask. We can't put a mask on a patient that's having high flow nasal cannula because they have terrible COVID in the hospital and need all sorts of oxygen. But you can wear a mask, and that helps keep your respiratory droplets out of the air. So that mask may be saying that it is not proven to prevent you from getting COVID. But I will tell you, there is good evidence, great evidence, that it will prevent you from giving COVID to people if you happen to be positive or asymptomatic. You just can't tell if you yourself have COVID. You can't say, I feel great, I don't have COVID. That's not, those two things that doesn't work. So everybody has to wear the mask, and then we will all protect each other. And there is better evidence now that those masks actually do a lot of good in protecting you from getting COVID, even when other people aren't. But I really think it's important to be extra careful about this and just have everybody wearing face coverings. Early on, the recommendations about not wearing face coverings were because we didn't understand as much about this virus as we know now. And we were really short on masks. We didn't want people buying up all the masks in drugstores and pharmacies and, Target, because we needed them to be in the hospital. We did not have enough for our staff that were taking care of these patients. Now the situation is better, and we understand better that fabric masks are protective and helpful. So it's important that you wear the best mask that you can, but leave the medical masks for the medical scenarios.
And that was actually another question someone sent in. I know we were concerned about PPE shortage in the beginning. I guess I'll start with Dr. Foster, but each of you, if you can just give me a quick answer, because I know we're running a little bit short on time. How sufficient is the PPE situation at Lurie, at the hospitals that you work at? Do you feel comfortable that there's enough right now?
Yeah, I definitely feel comfortable. I think like everyone across the country at the start of this pandemic, when supplies were really being used up very fast, we were having trouble, we were having shortages. We're in a really good place now, especially as we've done such a good job at lowering the rates. If I could just say real quickly, though, to piggyback off of what Dr. Landon was saying, one thing to just note, as we think about kids and their usage of masks and ability to wear masks, that's a big concern that comes up a lot. And a lot of parents and other folks express concern that my child, there's no way they will wear this mask all day in school. How is this going to happen? I think we really underestimate what kids are able to do, how adaptable they are, and how much they really do just want to follow the rules. Kids want to follow the rules more than we do. They want to know the boundaries and what the expectations are. And if they know that, hey, you have to wear that mask to go and see your friend at school, to be able to go to school, then they're going to wear their mask. And we have not had an issue with patients wearing their mask in our office, in the hospital. They wear it and they don't have a problem. So all kids age 2 and up should have those masks on when they're out and about, and just like the adults.
Okay, thank you for bringing that up. I think that's really important, again, as we address the back to school situation. So Dr. Robinson, any issues with PPE? Are you confident as long as we keep the numbers down, you will be supplied?
I think that if we keep the numbers where they are now, I think that we will be fine, but certainly this is a very fragile situation. I mean, we could have numbers significantly spike, overwhelm the system, and begin to consume a lot of PPE. And so we certainly have to ensure that that does not happen. And again, ensuring that all of our communities have access to masks, whether they're homemade or purchased, to help reduce the risk of spreading infection. I would describe it as like you're walking around with your hand covering your mouth, which reduces spread and germs. And so if everybody does that during flu season, we wouldn't have as much influenza. So
I think masks are going to be a fashion statement pretty soon. We're going to see all kinds of things come out of this. But the last thing I want to address is antibody testing. This has been so talked about. I mean, I know there's a lot of different tests. The FDA has been working to approve different ones. Some people said, why aren't we using this? Sandra wrote me, why aren't we using this if there is antibody testing to kind of get things back to normal? Sure. I don't know, Dr. Landon, if you'd be the most, able to address that. Are antibody tests accurate enough to use that right now?
So early on, a lot of tests were approved by emergency use authorization and may not have been as accurate about whether or not you have COVID. And some of them may still be somewhat inaccurate. In other words, you could have a positive result just from having a regular cold coronavirus last November instead of actually having COVID. So we wouldn't want to rely on that to say you're safe and good to go. The other problem is we don't know how long immunity will last from coronavirus. There's already some preliminary evidence that patients that had more mild forms of coronavirus do not have a durable antibody response. And there's evidence from other coronaviruses, the normal cold coronaviruses, your immunity only lasts 3 to 6 months after you have that. So, and we haven't had enough time to see. And so just because you had one positive antibody test doesn't mean that you're going to be good next month or even next week. Nor do we know exactly which antibodies. You can make antibodies to all different parts of the virus. And so we don't know which ones are the most important. And each test sort of identifies different antibodies. And so we don't know which one is the one you need to have in order to know that you're immune. With things like chickenpox and measles, where you can get good antibody tests, we have 50 years of experience knowing that these are the ones you have to have, and you have to have them in this amount, and then you'll be protected. We just don't have that awareness. So we can use antibody tests to help us diagnose some of the things that happen after coronavirus, like some of the children's syndrome, the multi-organ system inflammatory syndrome in children, or some of the weird vascular, sort of the COVID toes you've heard about and the rashes that happen later. You use the antibodies to help make those diagnoses, but they are not an immunity passport. They do not say that you are safe and good to go.
Okay.
And Lauren, that information may change over time.
Yeah.
But currently, we just don't know what to do with the information. It lets us know that you may have been exposed, but you can't really take an action from it. So in other words, we can't put healthcare workers on the front lines with no mask on because they had an antibody test that was positive. So I think what you're seeing from healthcare professionals and public health professionals, we're trying to be responsible. We're trying to share with you what we know and also let you know what we don't quite know yet. And we continue to get previews of evidence as additional research comes out, but we're just not at a point where we know definitively what it means, at what level the antibodies have to be present to give you immunity. We just haven't had the trials that have occurred to give us confidence in what to do with this. So I think it's really important that folks are patient, give us some time, recognize that this information, again, will continue to evolve.
Well, I'd like to use these last couple minutes just to go around and I want to make sure we talked about everything that you wanted to talk about, that you want to address. As we were saying ahead of time before we started speaking, I'm sure you get questioned all the time by people. So Dr. Foster, is there anything we haven't addressed that you want to make sure you get across?
No, I think we addressed a lot of really good points. Certainly, a lot of the questions I get have to do around the issue of socialization with kids and family members, in particular with grandparents really, really wanting to see either the new baby in the family or their grandkids. And we can't underestimate the impact of that relationship, grandparent to grandchild and vice versa, and how important it is for both parties, especially for the health and well-being of our older population. That can sometimes be they sometimes can be a bit more socially isolated in general, and they really get good mental, emotional benefit from interacting with their grandkids. So, life is a series of risks and rewards, and I think in that instance, we really have to kind of, on a case-by-case scenario, figure out what's the best scenario. And there are options, there are ways that you can safely achieve those visits, maybe an outside visit, assuming the families, as we've mentioned previously, are doing a good job of mitigating and minimizing their risk of exposure so they don't get grandma sick and vice versa, but maybe meeting in the backyard, socially distanced, and having those type of visits. But we can get creative and sort of, on a case-by-case scenario, figure out the best way to achieve overall peace and happiness and wellness for all families.
Okay. Dr. Landon, do you want to go next?
Yeah, I just want to say that masks are not political. Unless you literally have a political statement written on your mask, there is no political agenda that is served by you wearing a mask. The only message I get when I see someone wearing a mask is not, oh, you must be a liberal, or oh, you must be a conservative. The message I get is, oh, you care about human beings. And that's the message we want to share with everyone. And so we've got to let go of this idea that there's some sort of political need, like some sort of political benefit to being 6 feet apart and wearing masks. There's none. Nobody wants this. We all want to just live our lives the way we used to, but we also want to value our lives and the lives of our loved ones, and we value our health and our long-term health. So please, please, please do what you need to do in order to protect yourself, your loved ones, your friends, and the people that you don't know that matter a lot in this world. Wear your mask, keep your distance, and wash your hands.
Okay. Dr. Robinson.
I would just add that, we're in America's third largest city. We've made incredible strides in flattening the curve and reducing infections, and we have to protect the gains that we've made. It's not time for us to let our guard down, and so we have to be responsible. We have to wear our mask. I think wearing a mask is like, wearing underwear. Everybody needs to wear them. You don't go outside without them. Someone has to come to your house. They're going to have it on, and so we've got to ensure that we're all doing our part. And Dr. Foster, you're a pediatrician, but you spoke, great to the geriatric population and all of us that are in the middle that are caring for our kids as well as caring for parents as well. And so we do have to address the issue of loneliness that can happen with folks that are older and living alone. So let's be sure that folks are checking in with them using technology, FaceTime, Skype, getting those grandkids connected with with the family members that maybe are grandparents that are in different parts of the country, so that we're able to attend to their emotional and physical well-being as well. And just certainly a pleasure to be here on the panel with everyone.
Oh, I can't thank you all enough. You guys have brought such candor and wonderful insight to something that I think we are all dealing with on a daily basis still. So I can't say I won't ask you to do this again in a couple of weeks. So thank you again for your time today. And thank you everyone for tuning in. We will, of course, keep you updated all the time on air and on NBCchicago.com. Have a great day.